Hi guys, so today we are continuing with the CST module. So this is actually part 2, so if you haven't seen part 1, please go watch that. So today we are continuing with the BLS course. So today is going to be all about AEDs, so that's the automated external defibrillator. So we're going to describe what it is and what it does and how to operate it, as well as like special circumstances. So what do you do when someone has like a pacemaker or something like that? We'll also talk about the different rhythms. So we have shockable and non-shockable rhythms. So we'll go over all of those in today's video. So let's start by describing what an AED actually is. So an AED, also known as automated external defibrillator, is a small, portable, lightweight computerized device that can detect abnormal rhythms of the heart. So when it detects that abnormal rhythm, it can then send shock to the heart muscle to stop the abnormal rhythm and reset the heart, allowing it to return to its normal rhythm. So it's important to note that the time between the actual cardiac arrest and the onset of defibrillation is actually a very important factor in terms of survival from a sudden cardiac arrest. Before moving on to actually talking about how AEDs work and how we use it, let's first go over just the basic arrhythmias. So arrhythmias are just abnormal rhythms of the heart. So this can happen when electrical impulses in the heart cause the heart muscles to beat either too fast, too slow, or just very erratically. There are mainly two life-threatening arrhythmias that can cause a sudden cardiac arrest. So the first one is pulseless ventricular tachycardia, or PVT for short. So pulseless ventricular tachycardia simply means that the ventricles are beating really fast to the point where they're not filling with enough blood and therefore not pumping enough blood with each beat, to the point where we can't really feel any pulse because there's not much blood being pumped around. The second one is called ventricular fibrillation. So this might actually be more dangerous because in this case, the ventricular muscles, they are beating really fast, but also in a very unsynchronized manner. So the ventricles are just quivering. They're not beating, in a synchronized fashion, which means that not much blood, if any, actually is being pumped around the body. So what an AED machine does is it senses these abnormal rhythms. It senses these arrhythmias and prompts you to deliver a shock if it senses a shockable rhythm. So that's the PVT and VFib. There are also other rhythms like the non-shockable ones. So the non-shockable rhythms are mainly asystole and pulseless electrical activity. So what the AED does is once it detects the abnormal shockable rhythms, it prompts you to deliver a shock to the heart muscle. So what this does, it temporarily stuns the heart muscle. So it stops the heart from beating. And this allows for the reset in the electrical system. So this actually it gives the heart a chance to stop and reset back, hopefully, to its original normal rhythm. So now let's talk about how to actually operate an AED machine. So when you get the machine from the box, usually it really depends on the manufacturer's AED machine, but usually it turns itself on. If not, then you just have to power on the AED machine. And then you get the pads and you attach the AED pads directly on the patient's bare chest. So for any victims over the age of 8, you have to choose the adult pads, not the pediatric ones. Once it's on and the pads are attached to the victim, the AED machine would analyze the rhythm of the heart. It will prompt you to clear the victim, so make sure that no one is touching the victim. And if it senses a shockable rhythm, then it would prompt you to deliver a shock. And again, make sure that the victim is clear, that no one else is touching the victim. And then once the shock is delivered, it causes contraction of the muscles. If no shock is needed, so for example, if the rhythm that the AED machine detects is non-shockable, then what you do is you just immediately continue with CPR. So generally, there are two different AED pads placement options. So they're called anterolateral and anteroposterior. So anterolateral placement of the AED pads basically means that you put one pad just right under the, directly under the right clavicle. So just kind of here. And you place the other AED pad at the side of the left nipple, just a few inches below the armpits, so just there. So it's kind of like this. And the anteroposterior placement means that one pad you place on the left side of the chest, so between the left nipple and the breastbone or the sternum, so it's kind of like there. And the other pad you place on the back, so on the left side next to the spine. Usually there would be 2 sets of pads on the box. So it's really important that you don't use the pediatric AED pads on adult victims or anyone over the age of 8, because the dose of shock that will be delivered would otherwise be too small to be effective. So let's talk about the different special situations that you might encounter. So firstly, what do you do if someone has a hairy chest? So usually there is a razor in the AED case. So what you can do is to shave the victim's chest if it's really hairy, to allow the proper placement, so that to make sure that the pads actually stick to the victim's chest. Or because there's 2 sets of pads usually there's a pediatric and an adult one. So what you do is you could take the pediatric pad and you stick it on the victim's chest, and then you just pull it off really quickly, as if like you're waxing their chest. And then once that you got rid of some hair, then you could stick the adult pads on, which you will use to actually connect to the AED machine. What do you do if there's like water around? So what if someone loses consciousness and becomes unresponsive, like next to the beach, next to the sea or something? Well, because water is a really good conductor of electricity, what you have to do is to pull the victim out of the water fast. Once you've pulled the victim out of the water, if their chest is like covered in water, then you can just wipe it down before attaching the AED pads. So what do you do if the victim has like an implanted defibrillator or pacemaker? So usually people who are at risk of sudden cardiac arrest might actually have these devices implanted into them. So if you place the AED pads directly on top of these devices, then these devices might actually block the shock. So that will reduce the effectiveness of the shock. The good thing is that these devices are actually quite easy to identify. So you would see and you can palpate like a hard device underneath the skin. It would be like the size of 1/2 of the deck of playing cards. And what you can do when you're attaching the pads is to not attach them directly on top of these implanted device. You could attach it like next to it, but not directly on top. And finally, what do you do when the victim has transdermal patches? So transdermal patch are like medications. So this could be like nitroglycerin, pain medications, HRT medications, even nicotine. So what you do is obviously you don't place the pads on top of these transdermal patches, because that might again block the delivery of the shock, and it might cause small burns to the patient's skin. So what you need to do is, if there are gloves available, then use gloves to take the transdermal patch off so that you don't get in contact with the medication. And then you can wipe the surface and then attach the AED pads. So that's it for the part 2 for this CS2 module. For the next video, we're going to talk about the BLS sequence for children and infants.